It's great to see so many people interested in all of the different things we're going to be covering today. So the way today is going to work is that each of our three expert speakers will be speaking for 8 minutes each. Following the 8 minutes, I'll be cutting off speakers so that way we can save the rest of their great content for the question and answer period. If you have any questions during the process for our speakers, please feel free to type them inside the question box. We're going to be trying to get to as many questions as possible, but if we're not able to answer your question, don't worry. Our team, and we work hard with Imagine Canada to make sure that we can create additional resources to help you manage your teams and get your questions answered. So presenting this webinar with ONN today is Imagine Canada, Canada's national advocacy organization for the nonprofit and charitable sector. Today, Bernadette from Imagine Canada is going to complete a land acknowledgement for us while also introducing our speakers. Thank you so much for joining us, Bernadette.
Thank you. So yeah, just to start things off with a land acknowledgement. Oh, hello. ONN recognizes that we are on the traditional territory of the Mississaugas of the New Credit. This land has been stewarded by many Indigenous peoples for time immemorial, including the Wendat and Haudenosaunee. Toronto is also part of the Métis homeland and home to many Indigenous peoples from across Turtle Island. So on to our speaker introductions. Geeta Anand will kick things off. She is our first speaker today. Geeta is the Associate Counsel for Miller Thompson's Lawyers. Geeta's practice focuses on labor relations, employment law, and litigation. Advising and representing management on a wide range of matters, Geeta acts for clients within the private and public sector in both union and non-union workplaces. She has significant experience in advising clients on labor relations and employment law issues in the automotive, manufacturing, food and beverage, health and charitable, and nonprofit corporate sectors. Geeta also acts as an investigator fact finder in the public and private sectors, conducting workplace investigations involving employment-related issues. Thank you, Geeta, for joining us today.
You're welcome. Very happy to be here today, and hello everybody on the webinar. I'm sorry my visual isn't with me today, but I do want to emphasize that this novel coronavirus, which was classified by the WHO as a pandemic on March 11th, has really changed the world and changed our worlds as employers and as employees. And critically, every day you have no doubt seen not only the Prime Minister, but the leaders of all the provinces changing legislation, declaring emergencies, and putting us in a situation where we're trying hard to keep up. So dealing first with employee matters and employee legislation in Ontario, you may have known that there are many leaves available for employees under provincial legislation already: the family caregiver leave, the critical illness leave, the family responsibility leave. But now we have in Ontario a new leave, it's a special leave. It's called declared emergency leave, and it is as a result of the COVID-19 virus. So retroactive to January 25th, 2020, an employee is entitled to a leave of absence without pay if the employee will not be performing the duties of his or her position due to one of the prescribed conditions, including that the employee is under individual investigation, supervision, or treatment related to COVID-19, is acting in accordance with a public health order, is in quarantine or self-isolation as a result of directions related to COVID-19 issued to the public, is directed by his or her employer not to work, is affected by the travel restrictions relating to infectious disease and cannot reasonably be expected to travel back to Ontario, or is providing care and support to a designated individual because of a matter related to the infectious disease. And so this includes but isn't limited to school or daycare closures. So an employer can require an employee who takes this leave to provide evidence reasonable in the circumstances, but shall not require somebody to provide a certificate from a health practitioner as evidence in this case. So that is a new special COVID leave available. But as we all know too, the governments of Canada and Ontario and other provinces have leapt in to provide support to Canadians during this pandemic. And there are a number of changes that have been made to the employment insurance system. There's been the introduction of new benefits. And I just wanted to touch briefly on what's available without getting into too much detail, because each and every one of these programs has some specificity to it, and all situations may be different. So where it comes to employment insurance, the EI sickness benefit, the 1 week waiting period for EI sickness benefits is waived if an individual is quarantined, and as a result, individuals can be paid for the first week of the claim. If they can't complete it due to the quarantine, the claim can be backdated. And so that is a speeding up of the system, but as you all know, there's a backlog, and so the government is trying its best, I believe. But what they have introduced more recently is the new Canada Emergency Response Benefit, or CERB. And this program provides $2,000 a month for up to 4 months for workers who lose their income as a result of the pandemic. And the CERB covers Canadians who have lost their job, are sick, quarantined, or taking care of someone who is sick with COVID, as well as working parents who have to stay home to care for children due to school and daycare closures. And this CERB applies to wage earners as well as contract workers and self-employed individuals who are not otherwise eligible for EI. And additionally, workers who are still employed but not receiving income because of disruptions to their work situation due to COVID also qualify for the CERB. So this benefit is expected to be accessible through a web portal starting in early April, as well as telephone and toll-free numbers. So there's that. The next program that you should be aware about is work sharing, and the federal government has long had a work sharing program which is designed to help employers and employees avoid layoffs when there's a temporary reduction in the normal level of business activity due to reasons beyond the employer's control. And this program, which has been in place for a number of years, allows employers to receive a measure of relief in the form of EI benefits while working a temporarily reduced work week. So there's that, but there are special measures in place now, and these special measures are that the work sharing program can be extended from 38 weeks to 76 weeks, and there's a waiver of the mandatory waiting period between one agreement and the next, and there's an easing of other requirements, for example, the recovery plan. So there's the work sharing. There's also, for those of you who may be interested, a supplementary unemployment benefit plan top-up of employees' EI benefits during a period of unemployment due to a temporary layoff, illness, or quarantine. And this sub-plan needs to be registered with Service Canada and the CRA. And if so, it doesn't result in a clawback from the EI benefits ordinarily received by the employee. So there is a registration requirement for that, but I understand that Service Canada is working hard to deal with the requests to register as quickly as possible. And the fourth, or the next piece of news is that, and just announced Friday and expanded upon today was a wage subsidy for small businesses. And that is of interest to many of you on the line. The government announced a wage subsidy to help employers keep employees on the payroll. And in this program, the government aims to subsidize up to 75% of wages for qualifying businesses where business revenues have decreased by at least 30% because of the virus. And so it's not the number of employees that the business has that will determine whether or not they get this support. It's the reduction in revenue. And this program applies to nonprofit organizations and charities as well as companies big and small. And this one is about making sure that people are still getting paid, whether they work for a business that employs, 10 people or 1,000 people. So in the program, as announced today, the government will cover up to 75% of an employee's salary on the first $58,700 they earn. And this is backdated to March 15th, 2020. So I understand that Ministers Morneau and Ng are working to put together documents to explain the technical details of this measure. So
now, Gita, I'm just going to stop you for 1 second because we did get a few people asking if you could just repeat your last point about the recent government announcement regarding the 75%, the increase to 75%. Do you mind just repeating that again for people who maybe didn't hear?
Sure. So under the announcement today, employers, no matter what size, will get a wage subsidy of up to 75% of wages for qualifying businesses. Now, the technical details of this subsidy have not yet been released. I understand they will be released imminently. And so this applies to businesses large and small. And the government in the program covers up to 75% of an employee's salary on the first $58,700 they earn. So that means up to $847 per week. The government has also cautioned that the government is trusting businesses to pay the other 25% that is not covered by the subsidy if they can. So they're telling employers not to game the system. Otherwise, there will be consequences. And so that really what the government has said is every effort should be made to top up wages if they can, and employers should make every effort to hire back workers that have been laid off in the past 2 weeks if they can qualify for this program. And that's really all that was said today, but I understand there'll be more detail forthcoming in the next couple of days. So the next thing that many of you may have thought about or confronted already are temporary closures and layoffs. And so this is a tricky area if you don't have a union. If you have a union, there may be layoff language in a collective agreement, but we know that certain collective agreements in the health sector and in long-term care have been suspended for now, but for all others, they still apply. But what it comes down to is whether employers can reduce hours and days of work. And the answer, as is so many times, it depends. So if you have non-union employees, depending on the magnitude of the reduction, the loss in hours, and accordingly in earnings, this could amount to a fundamental change to the employment relationship, which would trigger theoretically a constructive dismissal. And ordinarily that could give rise to a claim for lost income. However, in the present circumstances, it remains to be seen whether a court would see such a step as being anything other than reasonable. So to the extent that a reduction is undertaken to reduce immediate financial strains, potential liability would likely be pushed off into the future. So this is a tricky area. Clearly, businesses and organizations are fighting for, their existence. It's existential threats. So, in these cases, frank discussions and communications with employees is taken in advance of imposing those kinds of changes, may make changes more palatable. There is certainly, employers should know, if you're non-union, and the unionized employers would know this, that a temporary layoff under the Employment Standards Act is 13 weeks. It can be up to 35 weeks if benefits are maintained, or if there is one of the sub-plans I had referred to earlier. So that is a temporary layoff. And then anything after that or longer than that becomes a permanent layoff, which triggers the payment of severance pay and termination pay under the Employment Standards Act. Now, employers in Ontario have attempted to lobby the minister on with changing the act on the constructive dismissal side, but so far the legislation remains as it is. That's the temporary nature of the layoffs. Now, in terms of operating virtually, some of you may be, if you are deemed a non-essential business and have to close except to work remotely or electronically, what we're seeing in practice is a number of employers trying to put in place, if they don't already have one, temporary work from home policies. And that would be a good idea if you are having employees work from home. There should be a clear policy setting out a number of things, including such things as availability, communication, duties, a statement that the organization's policies and procedures would apply to the work and the conduct of staff members working in home offices, an acknowledgement of the fact that the organization must be able to access the employee. There may be something that says that employees must seek advance approval from the organization if there are changes to work schedules and overtime and things like that. There must be an addressing of technology issues and who's responsible for what, i.e. who provides or pays for the high-speed internet connection, who pays for the tools that are necessary to work at home. Then there should be a whole area dealing with privacy, information security, and confidentiality of information of the organization, and how that is going to be accomplished. Clearly, if there's going to be a work from home arrangement, then there should be it should be set out in a document about expectations of privacy, about separating work from home type activity, and an acknowledgement of the privacy legislation, and then something that says what happens when you return, or when you may be requested to return, and how you have to return when requested to do so. So I think that it would be wise, if you could, if you have a number of employees working at home, to look at having a clear policy on that. And I just wanted to touch on something that has come up a lot in practice as well, is what about the job offers that are out there, particularly, say, for summer students or interns or people who have joined very recently and have either not started or just started? What do you do with them? And what we're seeing is, as part of the, if they haven't started, part of the offer letter may have language that deals with an understanding that there may be a need to defer start dates, and something that sets out, if we need to close our office, we're going to defer your start date, and we can provide you with an anticipated work date. And until you start, you won't be eligible for pay and benefits. A number of employers have, yes?
Thank you so much. We're going to cut you off right now and save some of this content for the question and answer period, just because we want to make sure we have time to get to all of the questions that we have coming in. So I'll pass it off to Bernadette to do the next speaker introduction, but thank you so much for taking the time to give us this in-depth information. And just to let everyone know on the call, we will be following up this webinar with a slide deck that covers some of the points that we talked about today, because we know that some people are having technical issues. It can be hard to hear when there's so many different people using the internet during these times. So please do not worry, we will be sending more information following the webinar as well. Off to you, Bernadette.
Thank you. So up next is Paula Speedback. She is the president and CEO of Volunteer Canada. Paula joined Volunteer Canada after serving as the managing director of Carleton University's Centre for Voluntary Sector Research and Development. She has taught both graduate and undergraduate courses in nonprofit management and community service learning. Prior to her focus on applied research, Paula enjoyed a 24-year career as a practitioner and senior manager in the nonprofit sector in both institutional and community-based settings in Montreal, Ottawa, and Pan-Canadian initiatives. She holds a Master of Management degree from McGill University and the McGill-McConnell Program for National Voluntary Sector Leaders. She was also my prof at Carleton University's Masters of Philanthropy and Nonprofit Leadership program. That's an aside. Thanks, Paula, for joining us today.
Thanks, Bernadette, and thanks all of you for joining as we all try to figure out together how to manage through this. I wanted to start by saying that at Volunteer Canada, we began by convening the folks that we deal with to really find out what the issues are and what's needed most in terms of volunteer engagement. So we did, of course, convene the local volunteer centers, who are the local experts and leaders in volunteer engagement. We spoke with business leaders in community investment through the Corporate Community Engagement Council, and we spoke with nonprofits across the country who are members and non-members of Volunteer Canada. And so, as many of you know, in terms of volunteer engagement, a number of organizations had made decisions early on to close their operations and activities if they deemed them to be non-essential or if they felt that they could be temporarily suspended. Others actually ramped up their services because the people that they were providing service to were vulnerable and were even more vulnerable in this situation. Others were looking at ways to modify their programs and service delivery so that they could still continue to provide some level of support, perhaps in a lower touch or a virtual environment. So all of these things gave rise to a number of questions. So the first one started with an overarching question, which is, are volunteers considered to be employees under the law? And the question was asked because from there follows the issue of what is our responsibility to volunteers and what is our responsibility for what volunteers do in our name. And because we are responsible for what volunteers do in our name and we're responsible for providing safe environments to volunteers in the same way we are to paid employees, for practical reasons, we always recommend that human resource policies apply equally to all those who provide service and work within an organization. So when we consider some of the other issues that arose, one was, how do you organize your volunteer program to keep volunteers safe and to keep the people they're working with safe. So that's one question that many have. The other is, if you are transitioning to a virtual format, and so volunteers who normally provided their service in person are transitioning themselves to a virtual format, what kinds of equipment, what kinds of policies, and what kind of training do you need to support that transition? Then there are virtual volunteer opportunities that you may want to develop in order to get other work done and build your capacity as an organization. And that could include pro bono services and skills-based volunteering opportunities that a number of folks who are at home now are able to do, particularly those volunteers who are not able to come in person any longer. So the need for resources on how to transition to a virtual format and how to develop skills-based volunteering and pro bono services is also an issue that was brought to our attention. The other issue brought to our attention was, how do we keep volunteers engaged, and how do we keep connected to volunteers, particularly when you have older adult volunteers who are staying at home for the moment, as they should, and for whom volunteering has been their key connection to the community. We then become concerned about social isolation of people who were previously volunteering with us. And so many organizations are looking for ways to stay connected to volunteers and to check in on volunteers. A final issue that came up was the issue of National Volunteer Week and volunteer recognition. And while in some ways 3 weeks from now could be very different, as we've seen the situation evolve so quickly, many organizations are feeling that more than ever we need to find ways, creative ways to recognize volunteers and celebrate National Volunteer Week virtually, so that we could recognize those volunteers who volunteer year-round, who may be temporarily not connected to us, but also those who are stepping up to volunteer even more in this situation. So those are some of the issues. How we've responded to that is by providing resources. We have a page on our website that has resources that speak to each of these issues. We've been in touch with our international colleagues around the world who are also doing work in this area, and we're all sharing our resources, translating it, and really looking at the Canadian context. Always, of course, with in mind public health authority advice and directions as the broader context. When we look specifically at risk and liability of volunteer programs and protecting volunteers and protecting those volunteers serve, some of you may be familiar with the screening handbook that we produced in collaboration with Public Safety Canada. And if you look at page 43 of the screening handbook, which we can send you the link for later, there's 4 questions that you ask when you look at the risks involved in a position. So who is the participant or client? Are they vulnerable, and in what way? What is the nature of the activity? Is it discussion? Is it current events? Is it helping with personal hygiene? So what is the nature of the activity? What is the setting? Is it in somebody's home, or is it, as we're doing now, virtually? And what is the level of supervision? And in going through those 4 questions, that helps people come up with what kind of screening and policies do we need to put in place to protect both volunteers and those they work with. And screening, as described in the screening handbook, the 10 steps of screening, most of it is applied in person or in an environment where we're able to access folks in person. And so what we're in the process of doing is looking at the screening steps and seeing how do we adapt them in a virtual environment. And so starting with those 4 questions and then thinking about what do we need to know in order to effectively screen and match people to positions. The other thing that people are starting to do is to, particularly among volunteer centers and the local nonprofits in their communities, is to be in touch with organizations who have already screened people to work with vulnerable populations, and to be in touch with those volunteers who may be willing to be redeployed to respond in the current situation, so that there's already some level of screening that has taken place, and that the organization who then involves those volunteers can complete the screening in a way that makes sense for them. So these are some of the things that people are doing to be innovative. Keeping in touch with volunteers and keeping them engaged is a concern. And so, as I mentioned earlier, either by checking in and making sure volunteers are okay, or having virtual connections to check in with people, to provide interesting training in the meantime to keep people involved in the organization around things like crisis communication or understanding mental health issues, or a variety of topics that many volunteers are interested in for their current and future work. So those are some of the things that we've put in place and some of the things we've heard, and I'd be happy to answer any questions you may have.
Okay, thank you, Paula. So next up is Sherry Ellis. So Sherry Ellis is the Vice President of People, Talent, and Culture for the Neighbourhood Group. With over 20 years experience in human resources, Sherry has led teams in both the private and nonprofit sectors. Her experience includes managing human resources and teams within Toronto Community Housing, Zoomer Media Limited, and Craft Canada. Thank you, Sherry, for joining us today. Over to you.
Thanks. I'll just try to speak up so that you can hear me. So a lot of information has already been covered by Geeta and Paula. What I wanted to talk about are a couple of things to do with policies, communication, compensation, and just mental health and support for everyone. So some of the policies that we have to think about at this time are things that we already have in place, and there's some things that we may not already have in place. Things like internal communication. Is everybody in the organization able to send all staff emails? One of the things that we've noticed in this period, which people keep referring to it as unprecedented time, is that there is so much information coming at us all day, every day. And at the beginning, a lot of our staff were sending emails, everything that was coming into them, they were sending to everyone. And then everyone was responding to those emails, which was creating even more email. And so we actually had to put in place something that guided how that was happening to try to minimize the number of emails coming at everyone from everyone. One of the other things that we want to think about is external communication. So who is allowed to communicate on behalf of the agency? That needs to be very clear. And if you don't already have that policy, I wouldn't be surprised if people have already put something out now to put that in place. Geeta talked about working from home, and actually so did Paula. And some of the things that we talked about in terms of guidelines that need to be discussed if they're not already in the policy are things like technology, privacy, confidentiality. We had this situation where a few of our employees were actually anxious about the idea of using technology to log in from home because they'd never done that before. We also had employees who did not have or want internet access, and we had to deal with how do we handle that when the only way they can do their work is to have internet and to work from home. One of the things that we've talked about too is while working from home, there's an expectation that employees would be accessible and available during regular working hours. And also, how would you handle performance expectations that may or may not be being met during this period? One of the things that we're talking about, that a lot of people are talking about, is redeployment and how we assign employees to work in other departments. What kind of work is done and how does it get done? And there's a lot of uncertainty, and so communication tends to become very important at this point, and that's the next thing I wanted to talk about. We're finding that we have to find all kinds of ways to reach our staff and our clients and try to keep the information as simple and as clear as possible. Luckily, a lot of the communications that have been sent out through the community have been translated into different languages that are helpful to clients. And a lot of our employees, English is their second language, so a lot of that's helpful for our employees as well. This need for communication also means that we're including all different kinds of technology and different ways of communicating with our staff. I mean, we're using leading edge technology, but we're also using old school methods like mass voicemail and phone trees. And it really depends on what our clients, what our employees do, how they work, so that we have to make sure that we adapt our approaches to communication to our employees and how best to reach them. So one of the other things that a lot of people are talking about, and this will be an ongoing conversation, is how are we compensating all of the different categories of staff in all of the different situations related to the virus and the impact that it's having on our communities. So these different situations, the list is growing and it's changing by day. So you have staff who may have tested positive, or who lived with someone who tested positive, or someone was exposed to someone who tested positive, staff who can work from home, staff whose programs are closed and can or can't work from home, staff who have to be redeployed, or staff who can't be redeployed based on all kinds of different reasons and situations. So what we've realized is that we have to have a short-term plan for compensation as well as a longer-term plan, and these plans are different. Because as we've seen, there are all kinds of different information that's coming through in terms of things that are available from the government to support staff who can't work. And we have to be adaptable so that as the landscape changes, we're able to change, which right now we're seeing is a daily need. One of the other things that we've been talking about is that metrics are very important. We need to be tracking what we're doing for which group of people so that we can be consistent. And of course, as Geeta mentioned earlier, the environment's different depending on whether it's a unionized environment or a non-unionized environment in terms of the impact on the collective agreement or the impact of the collective agreement on the plans that we make and the steps that we take. Then the last thing I wanted to talk about is mental health and support, because what we're noticing is that everyone in the organization who can work, whether they're working in the field or from home, is going full steam. And these resources are finite. You know, everybody has a threshold, and we have to respect that threshold. So we need to think about who can step in to help to support managers and frontline staff. And we need a plan for what happens if very senior team members get sick and actually can't work at all. So who steps in and who steps up? So in some organizations, if you have an EAP program, it's an excellent idea to broadcast that contact information now, whether it's a telephone number or online access, and communicate that regularly so that people have that if they need it. Our benefit provider gave us access to online and telephone counseling, which was awesome and excellent and very helpful. We also know that there is a large group of Ontario-based mental health professionals who have offered their services, and information about that has gone around through the community over the last week, I believe. So one thing that we've noticed is that no one's immune to the burnout. So if it's possible to provide some time for people to step away from active duty, they should really take advantage of those opportunities so that they're refreshed and able to come back at this, because the energy level required to handle everything coming at us is very high. We're recommending to managers that they check in with people, you know, ask them how they're doing, ask them if there's anything that they need, and remind them that if they do feel overwhelmed, that those resources for mental health support are for everyone. And one of the things we're also seeing is that this kind of isolation can cause a high level of fear, helplessness, and anxiety, even in very stable people. And when we think about the clients that we serve, they're even more vulnerable in this kind of situation. And actually, one of my colleagues jokingly commented that this is hell for extroverts, the ones that can't get out to spend time with everyone like they're used to. So those are some of the things that I just wanted to bring forward, and I look forward to any questions.
Wonderful. Thank you so much. So now we're going to be starting our question and answer session. Thank you again to our speakers for taking the time to share your expertise. We do have a lot of questions for you, and we're going to try to get to as many as possible. But as I said before, we are going to be sending more information following the webinar. So please do not be discouraged if your question isn't answered. So I'll pass it off to my colleague Sarah, who will be completing our question and answer session.
Good. Hi, everyone. Can you hear me okay? This is Sarah Matsushita. I'm the Director of Communications for ONN, and I've been watching all of the great questions that you've already posed. Please feel free to put more questions into either the chat box or the question box, preferably, so we can keep a running total. So we will, first of all, I want to turn it over to Geeta. Geeta, we've got some HR questions from a legal perspective that I'd like to pose to you.
Okay.
So the first question is, you mentioned before, in terms of staff who can't work, you mentioned that there need to be evidence provided and evidence reasonable to the employer. Besides a medical certificate, what would be useful?
Well, if they say that they just got back from a trip, you would know that, presumably if through the attendance management. So some employers may ask to see the tickets or what, whatever it is, or evidence of travel into a zone that is a high incidence zone. You may want to have evidence of a car trip. It's really just what's reasonable to kind of persuade the employer on the balance of probabilities that this employee is being forthright. Some of you may have read about the McDonald's in Hamilton that shut down and warned everyone and told public health when an employee came and said he tested positive for, well, he sent in a note which ended up being forged. So it's a difficult thing. Sometimes the note, obviously the government in the legislation has not put the requirement that there be a medical note in all cases. And it's really about some level of trust. But if there is something you can think of that might help support the employee's request, you could ask for it, as long as it's reasonable. That's really all the guidance you get.
Okay, thank you. Thanks very much. And a couple of more questions for you as well, Geeta. This is a big question that we're getting. I don't think we have an answer yet. Are nonprofits included in the 75% of wages being provided by the federal government? And does the employer need to pay the other 25%?
Yes, they are.
They are. Good. Okay, so that is confirmed, and that is the case. And does the employer need to pay the other 25%?
Well, the government is encouraging strongly that the employer pay the other 25% if they can. And I think what the Prime Minister said today was he doesn't want employers to game the system and take the subsidy and not do their part.
Thank you. Okay, and for the wage subsidy, is it correct that organizations won't be getting a check from the federal government, but will be able to reduce their remittance to government by the amount of the subsidy?
There will be some, so I don't know if it's separate, but there is a deferral of remittances as well. There's a deferral of GST, HST payments to the end of June for monthly, quarterly, and annual filers.
Okay, thank you. One question about paying staff who are self-isolating due to suspected or confirmed cases. Some employers are paying for the 14 days the staff are off, while others are allowing staff to take sick time or vacation time to be able to make up that time. Do you have any advice in terms of best way to handle this?
Well, it comes down to affordability. So an employer can direct when an employee takes a vacation. And under Ontario law, it's something that an employer can do. They can say mandate the vacation. So sometimes if there is a high enough vacation bank, an employer will mandate a vacation just to keep payments going and reduce the vacation accumulation in the bank. So the liability isn't there.
Wonderful, thank you. One last question on the HR legal front. If an employee was hired before COVID-19 with a later start date, are employers legally able to defer that start date?
Yeah, that's one of those ones I was just getting to at the end of the, so that there is this debate about that. Can they legally do it? Well, depends. And sometimes there's risk. There's risk to doing it, but in these times, the risk, as long as there's some mitigation of risk. So can you withdraw the offer? That would be more risky than setting a new start date, for example.
Okay, thank you. Thank you. That's really helpful. Thank you so much, Geeta. I'm going to turn to Paula now to ask a good question. Do you have a recommendation for platforms for developing interesting training to keep volunteers engaged?
There are a number of local volunteer centers who have done that. I know that the Volunteer MBC, the Volunteer Center of Waterloo Region, Volunteer Ottawa, a number of other volunteer centers around the country have developed platforms for training. And at Volunteer Canada, we are looking at collecting some of those and being able to refer people to those. So the best starting point is, would be the local volunteer center, and as well look on volunteer.ca on our website to see where those are taking place.
Okay, wonderful. Excellent. Thank you very much. And are there any sites in terms of connecting to volunteers now? Are there ways that you would recommend organizations can direct folks to?
To connect volunteers who want to volunteer?
Yes.
Okay, so again, many local volunteer centers have existing volunteer matching systems on their websites, and a number of them have actually isolated those that are COVID response or virtual volunteer opportunities. So again, if you wanted to check on our website, volunteer.ca, you'll be able to find listings of some of those centers that have those platforms. In Quebec, for example, there's a provincial system called Je Bénévole. There is also a system in Alberta, Volunteer Connector. There's one in BC, Volunteer Now, and many, as I said, local volunteer centers that have individual systems that are able to connect people to opportunities. The thing to keep in mind is that as organizations had to quickly close down or shift and deal with this change, that many of the volunteer opportunities that they may have posted on volunteer center databases may not be active right now, and there may not have been the time to be able to update those. So people need to be patient with figuring out what's current. But in many cases, they'll be clearly marked COVID response or virtual volunteering.
Great, that's very helpful. Thanks so much, Paula. Excellent. And turning to Sherry, you've got some questions about managing employees, especially talking about mental health supports. There are a lot of folks who are interested. Do you have some recommendations for where folks can turn to for good supports?
That's a really good question, because one of the things we realized, we don't have a formal EAP program, like employee assistance program. But as I had said, our provider gave us access to some support for employees who already have benefits. But we have also a group of employees who don't have benefits, so we were looking for things for them. And there have been a number of things that have been communicated in some of the emails that have come across. Community supports, that group of Ontario-based mental health professionals. There was a really, there's a large number of them available. And there was a link to their information, which I can look for after and provide it to you so that you can share that. I think that's really good, because there were all kinds of, there were social workers, psychotherapists, all kinds of professionals in different ways that were willing to offer their help. And so that was for everyone, from senior staff down to the frontline staff. And let me see, if I have anything else here. I think I've seen a couple of new things that have come across recently, and if I will send those to you as well so that you can share them.
That would be great. Thanks so much, Sherry. Another question for you. Do you suggest finding ways to have full team check-ins or team building opportunities via remote video access?
Absolutely. It's funny because there's so many different ways of connecting with people, and this has forced us to use ways that we may not have used regularly before. I know that a number of our teams are meeting. They have a conference call, if not daily, then they set a day and a time that everyone calls in, and they get a chance to share what's going on, share information, same time, same message, which is really important during this time because there's so much, there's information flying everywhere, all the time.
Yeah, that's really smart. Yeah, and the same time every day helps to create that routine. Excellent point. Also wondering too, could you just repeat, you had some great ideas for those managing without internet access at home. What are some ways they can, staff can do that?
Well, we have a large group of our employees, our PSWs, who work personal support in the community, and largely they don't have email because they don't need it for their work. I mean, there's some of them that have email access at home, but for work, they don't necessarily have email, although we're actually working on that right now because we think it's a great way to communicate with people. But with that group, we have a voicemail program, and their messages are left for everyone in that program. And there's a certain time that they all check in regularly. They're doing that more often right now. So that's very helpful because, again, same message, same time to that group of people. The other thing is the old school phone trees. And if for some reason we were not able to connect technically, we were not able to connect online, that's a good thing to have in place already. And I'm not sure if everybody's aware of that, depending on how long we've all been working. That's the idea where there's a group of people who are responsible for actually phone calling another group of people who are then responsible to call another group of people so that everyone gets communicated with over a certain time frame with a certain message. And you never know what could happen in terms of our access over this period.
Good point. So it's good for us to be nimble and to expect that, in some ways to expect the worst and to have another alternative. Great, thank you. Thanks very much, Sherry. Just wondering if folks have any more questions for our speakers. I know we have some specific questions on the legal HR, but I think those might be best answered if we can share that information with you post-webinar. But welcome any other further questions before we wrap up within this hour. Okay, Melanie, I will turn it back over to you. Thank you.
Okay, wonderful. Well, thank you so much, everyone, for joining us today. We hope that you were able to gain insight that will help you manage your team during these unprecedented times. We'll be following up shortly with an email that has the recording and also a slide deck. Additionally, we'll be working hard to create more resources and more supports because we know that there are a lot of things that we weren't able to cover today because there's so much to learn right now. We would love for you to stay connected with us and also with Imagine Canada, whether it's connecting over social media, joining future webinars, or becoming a webinar. We hope that we keep in touch and we stay connected. Thank you so much, everyone. We hope that you have a great day.